this week's Cardiology Countdown, we start with what may be a recent or final word on the question of drug-eluting stent versus bare metal stents. This in the highest risk patients, those with STEMI. This is, of course, where the whole firestorm started, where an observational study from a registry suggested higher mortality in those getting a drug-eluting stent. Well, thankfully, there have been randomized trials that take out the confounding, and published this week is a meta-analysis in the archives of 13 trials using patient-level data in 11 of them, looking at bare metal versus drug-eluting stents in STEMI. And what was seen was a significant, about 40% reduction in target vessel revascularization from 20 down to about 12%. But no difference whatsoever in death or MI or early stent thrombosis, all the feared complications. There was, however, a difference in late or very late stent thrombosis that is consistent with what's known of drug-eluting stents. And so this demonstrates the safety and efficacy of drug-eluting stents in this high-risk population from randomized trial data. At this week's number 2 spot is a paper on Galectin-3, a biomarker that looks at fibrin deposition and fibrosis in the heart. This is a novel biomarker that's approved for risk stratification in heart failure. And this was looked at in the Corona study, which was a study of ischemic heart failure patients looking at a statin versus placebo with rosuvastatin. And a very interesting finding was found that in this case, those with a low biomarker appeared to have greater benefit, in this case, of the statin. And so looking at patients below the median of Galectin-3, they had a significant reduction in total mortality and the primary endpoint of heart failure or death. And those above the median for Galectin-3 did not appear to have benefit of the statin. Then when they combined with BNP, interestingly again, the low BNP and low Galectin-3 patients had an even greater benefit of the statin. So a new biomarker that may pick out those patients with more ischemia and less advanced heart failure that may be less modifiable. And at the number 1 spot, have a paper in JACC looking at Eplerenone that was seen to reduce the risk of developing new onset atrial fibrillation. This was a sub-analysis from the Emphasis HF study. That was a randomized trial, showed a benefit of Eplerenone in mild to moderate heart failure. And here we see an added benefit of a reduction in development of atrial fibrillation. This may relate to atrial remodeling or just improved hemodynamics, but in any case, a nice finding of an additional benefit overall. They also found a reduction in the primary endpoint in patients with or without atrial fibrillation at baseline, meaning that this is really a new therapy we need to make sure that all patients with heart failure are getting. So for this week's Cardiology Countdown, I'm Chris Cannon.